Well, doctors will diagnose approximately 750 Louisiana patients this year with melanoma, the worst kind of skin cancer. That's an estimate from the American Cancer Society. Farmers and ranchers need to be extra mindful of spots on their skin because of how much time they spend working in the sun. TWILA's Avery Davidson shows us how the discovery of a small spot on one farmer's back may have saved his life.
Point Capee Parish sugarcane farmer Kenny Self spends many hours tending his fields out in the sun. He's been farming on his own since 1994, but what his wife discovered in September of 2012 was something he would not have found on his own.
One night, she saw a spot on my back that she was suspicious of, and we immediately sought a dermatologist who removed it and discovered that I had superficial spreading melanoma.
That's skin cancer and one of the nastiest forms. Dr. Lacey Tennyson is a dermatologist with the Our Lady of the Lake Physicians Group. She says there are 3 types of skin cancer: basal cell, squamous cell, and melanoma.
The first 2 are the most common. They're usually very superficial and very curable once we catch them. Melanoma, on the other hand, if caught early, can be curable, but also can be deadly.
Deadly because it can spread to other parts of the body, as Self learned.
Once we went to the oncologist and they started telling me what it was all about, then it really hit me hard that just the simple test results could determine a 95% swing in my survivability rate. One test coming up positive could mean as little as 5% chance of a 5-year survival, versus all negative tests is a 95% survival rate at 5 years.
Once it metastasizes and goes to the brain or other organs, then that can be a big deal. Chemotherapy, XYZ.
Dr. Tennyson says it's your exposure to the sun's harmful rays over your entire lifetime that can lead to skin cancer.
At age 18, you've already had about 80% of your sun exposure, so that's why we preach, please protect your children. But even when you're outside as an adult, every single day it's just adding up. And what the sun is doing is it's causing mutations that we usually have a very good repair mechanism happening. And the sun causes mutations, we repair it, but I like to explain it that once we get old enough, that mechanism gets overwhelmed and it sort of breaks, and then you start spitting out precancers and skin cancers.
As Self learned, you don't have to be old. He was 37 when his skin cancer appeared. If his wife were not a registered nurse, it might still be there.
The tumor was dead center of my back between my shoulder blades. It's not someplace you can easily see. It's not someplace that you're looking for something that small. It's very likely that I would still have the cancer today unknowingly if it wasn't for my wife, who was trained to see it.
A lot of wives come in here and say, I've been trying for years to get my husband to come. He has, several spots that I want you to check out. Or they'll come as a team, and then the wife points out things to me, which is kind of cute.
Cute and a potential lifesaver. In Self's case, the cancer did not spread, and he's under the care of an oncologist until October of 2017.
The size of the melanoma was so tiny compared to the scar I have today for the amount of skin and muscle that they removed to make sure that they had clean margins around it, to make sure that there wasn't any part of the tumor left in my body. For comparison, I say that the tumor was smaller than a pencil eraser, and I have a scar over 5 inches long on my back from where they removed the tumor.
Self is taking steps to prevent any further skin cancers by wearing sunscreen every day and reapplying it every 2 hours.
A lot of times men want to think that lotion is kind of feminine. Well, lotion can be life-saving.
He also wears special clothing designed to block ultraviolet rays and even refuses to take off his sunglasses when the reporter asks him to do so.
One of the other places that melanoma can go is into your eyes. And I get questioned by my oncologist every time we go if I've had any changes of vision, any problems with my eyes, any blurriness. And because melanoma can affect your eyes and can actually set into your eyes, one of the big things that I've started doing is to wear UV protective sunglasses all the time when I'm outside, when I'm driving. Anytime that I'm outside, I have them on.
So what advice does Self have for his fellow farmers and ranchers?
If you don't have a dermatologist, get one. see them regularly. Go to them every 6 months if you're exposed to the sun. Not just farmers, anybody that works outside regularly. Construction, anybody that's exposed to the sun on a regular basis. Get a dermatologist. Let them give you a head to toe at least every 6 months.
The good news is most of this stuff is so slow growing that we're going to be okay, and it's going to be curable. It's just catching it. 95% of the non-melanoma skin cancers are curable, so that's my job, is catching them early. And I like that. I think most dermatologists like skin cancer screenings because we're helping the patient.
As Kenny Self said, you should find a dermatologist and see them regularly. If you're in the Baton Rouge area, Dr. Lacey Tennyson is seeing new patients. We'll put a link to her contact information on our website, twilatv.org. And Kristen, this is one of those stories where, as a reporter, you try to keep yourself distant from it, but everyone I talked to who had been diagnosed with skin cancer was younger than I am. So that's really got me thinking, maybe I should go and follow the same advice that we're offering in that story.
Well, when I did the Ag Minute last week and you see the warning signs for melanoma, what to look for, I found myself half the night checking all the moles that I have on my skin because I spent a lot of time in the sun. So you're right, it's very scary.
Yeah, as you said in your story last week, 1 in 5 Americans will be diagnosed with skin cancer. So, that should tell you about how frequent this is, about how important it is to go out and get checked.
Good story, Avery.